We think that a big part of the uninsured in Missouri are due to the working uninsured, and that's the portion that we're going to focus on today, talking about what impact we can make on those particular uninsured folks. The issue is predominantly about the portion of the premium that the employer can contribute. Conversely, the amount of premium that the employee has to pay both for his single cost and if he has family, to cover his family. As the premiums go up, that portion or burden that the employee has to pay grows, and it causes every year more people to drop out. They will either drop out partially, and that's by dropping off their kids and their spouse, or they'll drop out totally by withdrawing completely on their own part. Now, when you look at the 3 to 9 size employers, the typical contribution that the employer pays of the premium is around 50%, 50 to 75% is what they'll pay the premium cost for a single employee. They typically will not pay anything for the family coverage.
And you're on page?
I'm on page 2. So, as you go up in size of employers, they contribute a larger portion of the premium. So that's why you see the percentage of uninsured reducing or the percentage of covered workers increasing.
Would you do even better if we eliminated for programs such as this, put some kind of a definition and eliminate some of the state mandates or make them optional, make them state offerings?
Well, yeah, I mean,
it leads into one of our next things that we want to talk about.
One of the things that we're talking about is actually I've included into your packets at the very last page a breakdown of the state mandates and what we price them at as a maximum and minimum range based on our pricing. But if you look on page 11, it kind of summarize that. Of the 22 benefit mandates in the state of Missouri, between 8.25 to 9.5% is added to premium because of those 22 benefit mandates. For example, the maternity benefit alone adds between 2.6 and 2.85% to individuals' premium just to carry that provision. Your chemical dependency benefit mandates is an additional 2.6 to 2.9% based on the cost of coverage. So your total impact, and this is not including the grievance and appeal and utilization process we have to deal with the regulatory environment, because that's kind of hard to price out what the cost associated with that is. But just on the basic books and principles of the mandates, you're looking at a 10.85 to 12.4% minimum maximum range of what the state mandates that are required upon the industry cost to an individual's premium. So to your point, Mr. Chairman, yeah, a suspension or a mandate light type program would be beneficial to decreasing the cost of that premium. A couple of the other initiatives that we're working on are obviously around transparency. And we're actually getting ready to roll out a program. The release date is yet to be determined, but sometime in 2008 is within the plan. It's called Anthem Care Comparison. And I'll let Randy speak to that a little bit in regards to what we're actually going to release to our members to give them an opportunity to look at cost and quality standards within the industry.
Yes, and we think it's really important for consumerism. We're one of the last industries that really hasn't become consumerized, and we're trying to address that. And that's comprised of 2 basic issues, quality and cost. Talk about the cost issue first. First thing we have to do is we have to get employees or citizens to understand that the actual cost of care is expensive. Many of our benefit designs up to this point in time has really shielded them from the cost of care. I see it within my own organization. I was at a church dinner a couple months ago, and the husband of one of my managers said, I really thought we had a better benefit plan at this, and where my wife worked at Blue Cross. And I said, Harvey, what are you talking about? He said, I had to pay $45 for my Lipitor. And I said, so let me see, you were on mail order, right? And you had 3 months worth of supply. Yeah. He said, 3 times 15, $45. And I said, you know what the cost of Lipitor is? He goes, yeah, it's $45, and I wish you would have paid more for it. And I said, no, it's $105 a month. You got $315 worth of drugs for $45. And he said, oh. Now that's someone whose spouse works in the business. So that's an indication of the lack of comprehension. So the first dawning or awakening is the stuff's expensive, and number 2 is the choices I make from a healthy lifestyle can have an impact on what my total cost is going to be. Once we do that, then all we have to do is really give them the tools to get that information, to get at it, and then take action upon it. What our studies have indicated that when you look at what people will do, if they're looking at a knee replacement surgery, for example, they will know less about the cost and the quality involved with knee replacement surgery at the facility and physician they're going to use than what they know about the new Ford Taurus that they're going to buy.